Most common ignored symptoms.
Uh, it is at the end of the heaviness of the limb is the ignored symptom.
So which is
Patient,
often, might
हाँ
be
सबको लगता है
कि
कि नहीं
tired
नहीं हाँ
है,
टायर्ड है दिन भर ट्रैवलिंग हुआ है तो स्वेलिंग आया
हाँ
है.
तो
नो
पैर में
इट इज नॉट
सूजन आ
लाइक
गई है,
दैट. यू
सुबह
शुड
ठीक हो जाता है ना, तो ठीक ही है ना.
it can affect young people. So I have operated 15 years male, which is
15
because it is congenital disease also,
अच्छा.
hereditary disease also, not congenital. It is hereditary disease also.
Acha. So apart from long-standing jobs, which is a very obvious risk factor, hereditary can also be a reason.
Hereditary, pregnancy,
Acha.
obesity, these are also risk factors.
Home remedies can make varicose vein disappear. Now this
No.
is what we were talking about, right? Malish kar lo.
No, no. Malish is absolutely contraindicated.
Okay.
It will cause the thrombosis in your veins.
अच्छा. So what are the other home remedies that you have come across which people say कि एक तो होगी मालिश, दूसरी I can say कि हल्दी लगा लिया.
हल्दी लगा लिया, तेल लगा लिया, कोई तो क्वैक बोलता है कि क्रीम लगा लो, वैनिश हो जाएंगे, ये हो जाएंगे. कोई भी पेशेंट आज तक नहीं मिला मुझे.
Varicose veins only affect legs, myth or fact?
It is myth because varicose vein can affect legs also. It can affect your anal system also. Hemorrhoids is type of varicose veins.
Okay.
It can occur at the umbilicus also,
Achha.
liver also. So there are many regions in the body.
Pregnancy and varicose vein, is it a cause or a coincidence?
It is cause.
Achha. So when it comes to the treatment aspect of it, does all varicose vein needs a surgical intervention?
No, it is not like that. Early stages we can treat conservatively, like
Achha.
compression stockings, exercises.
I came across a term which is called radio frequency ablation.
Yes.
So what role does radio frequency ablation has to play in case of varicose vein?
See, in recent days, radio frequency ablation and the endovenous laser ablation of the varicose veins are the main treatments.
Often dismissed as a mere cosmetic concern, varicose vein conceal complex vascular disorder that is frequently overlooked and undertreated. This episode dwells into why varicose vein are considered as a neglected disease, highlighting the subtle early warning signs that many disregard. We will unravel the diagnostic intricacies, explore cutting-edge, minimally invasive treatments that has revolutionized care, and discuss the potentially serious complications of ignoring this condition. Joining us today, we have Dr. Kedar Gorad, a distinguished surgeon with over 2 decades of expertise in laparoscopic and laser surgery. Currently serving at Sahyadri Super Specialty Hospital, Karad, he has masterfully performed more than 7,000 plus complex procedures, which typically comprises of thyroid, breast, and varicose vein. Dr. Gorad's advanced qualifications includes FMAS and FIAGES, coupled with specialized training in endovenous laser ablation, which is also known as EVLA, underscores his commitment to surgical excellence. Renowned for his clinical precision and empathetic patient care, he is highly regarded by both patients and peers alike. An active contributor to esteemed and national surgical forums such as ESICON and IAGES, Dr. Gorad continuously advances the field through knowledge sharing and innovation. Today, we dwell into his insights on cutting edge surgical techniques and patient care. Hello and welcome to another power packed episode of Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Kedar Gorad.
Hello, madam.
Hello, sir. How are you?
Hello.
So the name that needs no introduction, I'm very sure, and it's so nice to have you on our, Sahyadri Health Talk platform. How are you doing, and how does it feel to be on this platform?
So I am fine today, madam, and it is very nice to be here at Sahyadri Health Talks.
Yes, at our Sahyadri Health Talks.
Okay.
So before we dwell into today's topic, just wanted to ask you a few things about your journey. How has it been? So 15 plus years of experience in general surgery. I would not even bother to ask you कि कितने surgeries हुए sir अब तक, because I'm pretty sure कि you have lost the count. But then how has this journey been so far? Do you remember your first surgery?
Yeah, ma'am.
So how was it?
I have done hydrocele surgery in my residency period.
Acha.
And unfortunately, it is very good surgery and went all well.
Oh, great. But why unfortunate? I think that was the, stepping stone of such a beautiful career that you have done and such a great service to the
Actually, it is
mankind.
fortunate.
Yes, yes. So, moving on to today's topic, which is varicose vein. But when I asked you, कि sir, हमें करना है Sahyadri Health Talks topic, what topic do you suggest? And you said varicose vein. So the first thought which came to my mind was, कि being a surgeon, where you treat numerous patients with very basic and common problems like gallstones or piles or fissures or fistula, why did we pick on varicose vein today?
Because madam, varicose vein, I already told you it is neglected disease.
हाँ जी.
Because it is painless condition.
अच्छा.
पेशेंट को दर्द ही नहीं होता है.
अच्छा.
तो अनलेस एंड अंटिल पेन इज देयर, पेशेंट डॉक्टर के पास नहीं जाता है. सो इट इज नेग्लेक्टेड डिसीज एंड दैट्स व्हाई आई वांट टू टॉक ऑन वेरिकोज वेन्स.
तो सर इसके अर्ली साइंस एंड सिम्टम्स क्या होते हैं?
एक्चुअली मैडम अर्ली साइंस ये है कि पेशेंट को एट द एंड ऑफ द डे देयर इज हेवीनेस इन द लेग्स.
अच्छा.
टिंगलिंग होता है कभी कभी,
अच्छा.
हेवीनेस होता है.
अच्छा.
पेशेंट को डायलेटेड वेन्स दिखने लगते हैं.
अच्छा.
वो दिखने से पहले ही ये हेवीनेस.
बट होता क्यों है ये यूजुअली?
बिकॉज इट इज ड्यू टू लॉन्ग स्टैंडिंग जॉब्स.
अच्छा.
लॉन्ग स्टैंडिंग जॉब जो रहते हैं वो वेन्स के वॉल्व्स खराब कर देते हैं.
अच्छा.
सो दैट इज द रीजन द heaviness in the legs at the end of the day.
At the end of the day is what is said. And is there any particular, do we see it, is there any gender bias? Gender bias, like more common in male or more common in female or any particular age group?
Actually,
that we talk
in
about?
books it is written more common in females, but
Don't
I have
say
seen,
that.
but I have seen equal patients.
Acha.
Males may be common है, females may be common.
Okay.
It is not like that.
Okay, okay. So the early signs would be typically कि पैरों में झंझनाहट होना after a long tiring. Heaviness. Okay, heaviness and tingling.
Swelling,
also.
on swelling.
Okay, heaviness and swelling.
At the end of the day, swelling like patient.
Okay,
goes.
but is there any pain?
Pain is the last thing to come.
अच्छा.
Painless है इसीलिए तो neglected है.
So this is this feeling of heaviness which you said. I mean, it eventually gets over by the morning next day.
Yes,
when the rest is.
When patient sleeps, it will go.
It will go. So suppose if I feel this, I as a patient, if I feel that I have finished my day and I come back, I feel a lot of heaviness and swelling, some sort of swelling on my legs. So is it is it normal for me to reach out to a general surgeon directly, or who should I reach out to first?
You should go to general surgeon.
Okay.
For checking of that.
Okay. So you see patients who are directly coming up to you, or they usually go to multiple specialists and then
nowadays patients are coming directly, ma'am.
So the awareness
yes, awareness is going.
Okay, okay. So how do you see a change of shift in patients' attitude towards or behavior towards varicose vein in past versus now?
Nowadays accessibility to surgeon and the treatment are very common and easy for the patients. So patient directly comes to the surgeon and telling the complaints. Also government has made so many schemes to do the surgeries free of the cost.
Correct.
That's why also patients are coming.
So are there any other conditions which might mimic a varicose vein?
Conditions like cellulitis, lymphedema, and any swelling, bilateral pedal edema also mimics the varicose veins. Deep vein thrombosis also mimics like varicose veins.
So these are the common conditions which the patient gets confused.
Yes. Any swelling at the lower limbs or legs can mimic the varicose veins.
So what stage of varicose vein do you see these patients coming to you?
See, there are multiple stages I am seeing the patient.
Achha.
At the early signs also they are seeing the dilated veins or swelling at the end of the day. Patients are also coming. And when we do the Doppler, we can see the incompetent of the valves, saphenofemoral junction and saphenopopliteal junction.
Achha.
Also there are perforators, which are the veins joining this deep and superficial veins.
Achha.
Incompetent perforators also there. And even invisible or impalpable veins also seen on the Doppler.
Achha, so Doppler is the major diagnostic.
Major diagnostic.
Diagnostic process.
Major diagnostic.
So as you are saying that patients come to you, so are we seeing a gradual shift of patients' awareness in terms of early reporting of varicose vein?
Yes.
These days, yeah.
Yes.
So what would be the typical long-standing issues of not getting it treated or diagnosed at the right time?
Unawareness of the patient is the only issue.
Achha.
पेशेंट को पेन नहीं होता है तो पेशेंट नहीं आता है, ये मेनली इशू है। पेशेंट बोलता है कि नहीं जाने दो, पेन नहीं है तो क्या दिखाने का डॉक्टर को।
अच्छा।
इवन इफ आई एम सजेस्टिंग सर्जरी और सीइंग द पेशेंट कि अरे तुमको ऑपरेट करना चाहिए, तो भी वो बोलते हैं डॉक्टर कुछ तकलीफ नहीं है मुझे,
तकलीफ नहीं
देन
है
व्हाई शुड आई
और
ऑपरेट।
यूजुअली ये पैरों में होता है तो इट इज नॉट वेरी विजिबल आल्सो,
Yes,
सो एस्थेटिकली इट इज नॉट वेरी डिफिकल्ट।
they don't know the complications basically. That's why
अच्छा
they are telling कि क्या
अच्छा।
होता है डॉक्टर, कुछ नहीं।
Uh-huh. So we have spoken about the diagnosis part of it, which is we are saying that Doppler ultrasound is the
Yes, yes.
diagnosis. So is it always the only mode of diagnosis, or to confirm it, we do other processes
It
as
is
well?
the very important tool to diagnose the varicose veins because
Acha.
it shows incompetency of the saphenofemoral junction,
Mm-hmm.
saphenopopliteal junction,
Mm-hmm.
incompetent perforators,
Mm-hmm.
multiple varicosities along the legs. So it is the very important tool. It
Mm-hmm.
shows us or it guides us to treat.
Acha. So when it comes to the treatment aspect of it, does all varicose vein needs a surgical intervention?
No, it is not like that. Early stages we can treat conservatively, like
Acha.
compression stockings, exercises,
Acha.
drug treatment. Also, we
Acha.
can give at the early stages.
Mm-hmm.
But in later stages, there is SEEP classification for the varicose veins:
Mm-hmm.
clinical,
Mm-hmm.
etiological, anatomical, and pathological.
Mm-hmm.
This in clinical there are 6 grades. So we grade the patient according to the stage of the or grade of the varicose vein.
So while I was doing a little bit of study on varicose vein before, speaking
You
to you,
studied.
I came across a term which is called radio frequency ablation.
Yes.
So what role does radio frequency ablation has to play in case of varicose vein?
See, in recent days, radiofrequency ablation and the endovenous laser ablation of the varicose veins are the main treatments.
Acha.
Basically, they are minimal invasive treatments. No major surgery is required. Pain is very less, and complications are very less. And it is daycare. These are daycare procedures.
Acha.
So it is very easy to patient get admitted at the morning and discharge at the evening.
So as you said that we first try the conservative methods depending upon what stage of
Stage,
varicose vein
yes.
has come to us. So we start with the compression techniques, and later we take a call on the
Yes,
treatment.
yes, yes.
What is the role of this vein stripping? I mean, it sounds very scary.
No, it's not scary. We have done various surgeries at our residency days, open
Acha.
stripping methods, because
Acha.
laser ablation at that time that was not there.
So take us through this vein stripping thing. What is it?
Vein stripping means, ma'am, it is open surgery.
Acha.
We have to take a cut at the groin,
Acha.
see the saphenofemoral junction,
Acha.
ligate the all tributaries,
Acha.
and stripping means we have one stripper.
Mm-hmm.
We pass that stripper through the vein
Acha.
and pull it out all the vein.
Okay.
Along with perforators. But it is, as you said, it has very much complications that days.
So it is more kind of a procedure which was done during the past.
No, it is done nowadays also, but in
Acha.
medical colleges for teaching purposes, still it is there.
It is there.
It has some role.
And what is the role of this minimally invasive approach?
Minimally invasive is very nice approach to varicose veins patients.
Acha.
Because patients are scared of only that so big surgery, 5-7 days on the bed,
Yes,
and 1 month rest. So
Yeah.
they are scared of that.
Okay.
But nowadays, daycare treatment, admit morning, discharge evening, and you can walk on the tumor. You can walk on top.
So that's the role of minimally
Yes,
invasive.
yes,
So you
yes.
practically don't even need a overnight stay at a hospital
No,
unless there is some
no,
complication.
no.
Yeah.
Almost no.
Acha.
We have done almost 300, 400 surgeries here daily. One case we are doing here.
Acha.
So till date, no complication and no patient is staying more than 1 week.
Oh, great. So how does the post-surgery recovery looks like?
Basically, we don't have to look up to patient for recovery also.
Oh, is it?
It is very
Very smooth.
good, smooth surgery. It is.
Okay. So the patient can practically revert back to the normal
Yes,
life the next day
yes,
itself.
yes, yes.
Okay.
Patient is very happy next morning. Sir, it was very nice surgery. हमको पता भी नहीं चला और मैं अभी चल भी सकता हूँ. और in the follow up also they said, sir, it was very nice surgery. और हमारे ऊपर के जो दिख रहे थे, जो heaviness था, जो tingling numbness था, वो सब चला गया.
Okay, so the prognosis has been quite
Yes.
good post the surgery.
Yes, yes.
So do you remember doing any challenging case, which is, I mean, you might have had a lot of challenging cases in your career, but specific to varicose vein surgery or something varicose vein related, a challenging case which came to you?
I can tell you 2 cases.
Oh, great.
One case is challenging case
Acha.
because anatomy of that patient is very abnormal.
Acha.
That means like varicose veins, great saphenous vein is absent in the thigh,
Acha.
present in the leg only.
Acha.
Accessory veins are there.
Acha.
Multiple veins are there. Multiple perforators are there.
Hmm.
So literally we have to choose one vein and ablate it. So it is
अच्छा.
very abnormal anatomy patient is having.
ओके.
So
और इस पेशेंट की एज कितनी होगी? आई मीन व्हाट
एज
एज ग्रुप
उसकी
वी आर टॉकिंग
अराउंड
अबाउट?
35 to 40 होगी.
अच्छा.
लेकिन वो पेशेंट इतना डिफिकल्ट गया हमको करने को कि वेन नॉर्मल थी नहीं उसमें.
अच्छा.
सो वी हैव टू सर्च लाइक कहाँ से ढूंढे इसका क्या क्या, इतना डिफिकल्ट केस गए थे. बट फॉर्चुनेटली केस वेंट ऑल वेरी गुड.
So all went well.
All went well.
So the second case now, I'm all ears.
Second case, that is a good case because patient had ulcer.
Acha.
At the leg.
Acha.
And we have treated him.
Mm-hmm.
And on day 5, the ulcer disappeared.
Okay.
So it is the magic of endovenous laser ablation.
Oh wow.
Patient felt so happy.
Mm-hmm.
वो ऐसे खुशी से ओपीडी में आया मेरे पास और बोला कि सर मेरा अल्सर गायब हो गया. तो मुझे भी इतना, हाँ, इट्स अ वेरी प्राउड फीलिंग कि 2 साल से उसका अल्सर ठीक नहीं हो रहा है और हमने वेरिकोज वेन्स का ट्रीटमेंट दिया और उसका अल्सर गया 5वें दिन. सो पेशेंट से भी ज़्यादा मुझे ज़्यादा खुशी.
So I'm very sure these are the adrenaline rush that you get, you know, and which keeps you going forward, treating more patients. So if you have to give out one message to all people who are suffering from varicose vein, delaying their treatment, or people who are suffering from varicose vein and who needs treatment, what message that would be?
मैसेज इज सिंपल मैडम. बेसिकली उनको कॉम्प्लिकेशन समझने चाहिए. कॉम्प्लिकेशंस आर लाइक ब्लीडिंग, थ्रोम्बोफ्लेबाइटिस ऑफ द वेन्स, पेरियोस्टाइटिस, डीप वेन थ्रोम्बोसिस, देन डिस्कलरेशन ऑफ द स्किन्स, लाइपोडर्माटोस्क्लेरोसिस. स्किन इतनी थिक हो जाती है और उसमें अल्सर्स हो जाते हैं कि वो अल्सर्स ठीक ही नहीं होते जब तक वेरिकोज वेन्स ट्रीट नहीं करते हैं. सो अर्ली ट्रीटमेंट इज द बेस्ट फॉर द पेशेंट.
Okay. So basically, if your surgeon is telling you that you need a treatment, then you need a treatment.
Yes,
get it treated because it might be asymptomatic.
There
it might not be giving you
many
pain.
myths there are, मैम, कि ये क्रीम लगाओ, ये आयुर्वेदिक ये लगाओ, इस पे ये ऑयल मसाज
होम रेमेडीज कर दो, तेल मालिश करो.
So no. Malish is absolutely contraindicated because it may turn into deep vein thrombosis. So ये कभी मत करो. सर्जिकल ट्रीटमेंट इज द ओनली ट्रीटमेंट फॉर द वेरिकोज वेन्स.
ओके.
कभी भी आपको कोई भी बाकी की ट्रीटमेंट काम में नहीं आएगी. अच्छा. इवन इफ आई गेट वेरिकोज वेन्स, I need treatment. Okay.
Surgical. Okay, on that note, because as you said that there are so many myths, so we have another section which is kind of, I read out a few myths and I read out a few sentences. You have to tell if it is a myth or a fact and let's burst some myths today. Okay, so I'll start with some questions also, very crisp answers of those. So the first one is, varicose vein, is it purely cosmetic or a medical problem?
It is medical problem. It is also cosmetic, but basically it is medical problem and it needs treatment.
Okay. Biggest risk factor of varicose vein?
As I told, long-standing jobs is the biggest risk factor.
Okay. Compression stockings, yes or no?
Yes. Obviously, yes. It is the main part of treatment.
Okay. Most common ignored symptoms?
That is at the end of the heaviness of the limb is the ignored symptom.
So which is often, might be
सबको लगता है कि
टायर्ड
है, दिन भर ट्रैवलिंग हुआ है तो स्वेलिंग आया है,
तो पैर में सूजन आ गई है,
सुबह
ठीक हो जाता है ना, तो ठीक ही है ना.
It is like that only.
Varicose vein only affect older people. Myth or fact?
It is myth. Okay. It can affect young people. So I have operated 15 years male, which is
15
because it is congenital disease also, hereditary disease also, not congenital. It is hereditary disease also.
अच्छा.
Because उसके फादर में देखा गया है उसके. So there are hereditary
chances
incompetent valves.
Okay.
Hereditary deficiency in valves which can cause the earliest varicose veins in the young people also.
Oh, okay.
And they need treatment and I have operated and patient is doing good.
So apart from long-standing jobs, which is a very obvious risk factor, Hereditary can also be a reason.
Hereditary, pregnancy,
Acha.
obesity, these are also risk factors.
Okay, okay. I have a few questions on those as well. Crossing your legs causes varicose vein.
No, it is not fact. It is myth. It causes DVT.
Acha.
It may cause DVT, crossing
Okay.
over the legs, but
Okay.
not varicose veins.
Okay. Compression stockings cure varicose vein. Myth or fact? I think I know the answer.
Yeah, already I have
Already
told.
we spoke about that. Home remedies can make varicose vein disappear. Now, this
No.
is what we were talking about, right? Malish kar lo.
No, no. Malish is absolutely contraindicated.
Okay.
It will cause the thrombosis in your veins.
अच्छा. So what are the other home remedies that you have come across which people say कि एक तो होगी मालिश, दूसरी I can say कि हल्दी लगा लिया, because
हल्दी लगा
हल्दी
लिया, तेल लगा
तेल लगा
लिया,
लिया.
कोई तो क्वैक बोलता है कि क्रीम लगा लो, वैनिश हो जाएंगे, ये हो
हाँ.
जाएंगे. कोई
But
भी
नहीं.
पेशेंट आज तक नहीं मिला मुझे कि जो क्रीम लगा के वैनिश हो गए उसके वेरिकोस.
Okay. Varicose veins only affect legs. Myth or fact?
It is myth, because varicose vein can affect legs also. It can affect your anal system also. Hemorrhoids is type of varicose veins.
Okay.
It can occurs at the umbilicus also,
Acha.
liver also. So there are many regions in the body where you can get varicose veins.
But I think that then leg becomes the only part where it is visible
visible
directly
and
to us.
complications are more in the limbs, because
Acha.
ulceration and lipodermatosclerosis is common in the
Very
limbs
common
only.
in limbs only. Can varicose vein come back after the treatment?
Yes, it can come back after the treatment, because we are treating the diseased veins at present only.
Acha.
New connections new connections can occur, no ma'am.
Okay.
Suppose I treat the patient, and even if he is doing his long standing job again, so there are chances कि जो बचे हुए normal valves है वो भी incomplete हो जाएंगे.
अच्छा.
तो नए connections भी develop हो सकते हैं.
So
there
it's
are
not
chances.
typically a recurrence, but a new incidence
New
with new
incidence
incidences
also.
of varicose vein.
Recurrences also there. Basically, recurrence is due to I'm not saying bad surgery, but some missed perforators
Okay.
at the time of surgery.
Okay. Okay. Standing job or sitting job, which is worse? I think standing job.
Any prolonged job, standing or sitting is worse. Prolonged standing is bad for varicose veins. Prolonged sitting is bad for deep vein thrombosis.
So basically, चलते फिरते रहा करो, उठो,
Oh,
stretch
you have
करो,
heard
बैठो.
that term, no? E thrombosis
हाँ
nowadays.
जी.
E thrombosis is due to all sitting jobs.
Desktop jobs. Pregnancy and varicose vein, is it a cause or a coincidence?
It is cause. Pregnancy is caused because uterus gets bigger at the time of pregnancy. It will cause compression of the veins in the abdomen.
Acha.
So it will create some overpressure in the lower leg veins.
Okay.
So it is a cause.
Okay. So that's that. That's about the rapid fire and mythbusters. I would also want to ask, what is one myth that you are tired of hearing it from the patients with regards to varicose vein?
Varicose veins don't need treatment is the myth.
अच्छा.
By various patients. Treatment क्या करने की है सर इसको?
कुछ तो तकलीफ दे नहीं रहा है. क्यों करना है सर?
They don't know the complications basically.
True.
And when they come with complications, no, then they will understand कि क्या हो रहा है, कितना time लगता है.
Okay. Okay, sir. Thank you so much.
It is tedious for the patient. It is very easy for the surgeon to treat the earlier stages of disease than the complications.
Okay, so that's all about varicose vein. I tried covering almost everything that was possible. Do you want to, fill in something that I missed?
No, it is almost quite okay session and very happy. See, there are many questions and answers that can be done with the patients directly or doctors directly or on panel discussion. This is the only, what is
the
that?
Awareness, the basic
teaser,
awareness or teaser kind of
or trailer
stuff.
kind of thing.
Yeah.
Because there are, we cannot finish this topic in
such a short time. But then I think this is good for creating the awareness.
At least for
people
awareness
will
of the
know.
patient, just take the advantage of the schemes and doctors available.
Yeah.
And take a treatment.
Okay, sir.
At least when it is free.
Yeah. True. Okay, so on that note, thank you so much once again for coming on Sahyadri Health Talks and giving us your precious time. And we wish to, see you again on this podcast. On that note, signing off, Dr. Tushita, Sahyadri Health Talks.